Hey Paul, we spoke on Near FM this time last year, which was early into the COVID pandemic, and we spoke about the real threat COVID poses to Africa in particular. I know India is in the news a lot recently with their struggle against COVID. Could you start off by telling me what has and is happening in the developing countries in which plan works since our last interview, Paul?
Well, Darren, I suppose there's a number of things have been happening, and I suppose COVID is one of the biggest ones. And in a sense, you can look at this as a sort of a health crisis, but I think the way it has developed in quite a number of countries is it's an economic crisis as well. So we would know a lot of people who work in another country and remit money back to that country to their families. So remittance is down. The price for commodities is down, and tourism is not really happening at all. So while some countries may look at on the surface as if they haven't really been affected because the numbers aren't as great as what we've seen maybe in North America or in India, actually the economic impact of COVID is very, very far reaching right across the globe, particularly on developing countries and what has happened there. And that combined, when you're talking specifically about Africa, you've got quite a number of conflicts and that as well. And you've got the other C word, which is the one on climate change. So you're seeing some places are affected very much by the climate, and that can be droughts or floods, or it can be as a result of locusts. Some places have been very affected by conflict, which means people are displaced and farmers basically can't grow food, and they don't have the confidence even to grow food because they know they may face attack from various sort of groups and can't really grow food. So, and then you've got the impact of the economic impact really from COVID, but also the health impact. And indeed, sometimes we see that really playing out probably for one section of the population where plan focuses a lot on is for girls, and particularly for girls and young women. So we see huge numbers of children out of school still. So I know we've seen here in Ireland in the last number of weeks how children have gone back to school, whereas in a lot of developing countries, the schools have not really reopened to the same degree, and even in the same way that girls may have been forced to get married, or just they may not go back to school to where they were before.
Yeah, some of the implications of COVID are devastating, I think. Paul, how would you describe the prognosis of the fight against COVID in the countries in which you work, developing countries?
Oh, I think it's in some places a little bit like if you looked at India only about a month ago or more. People were saying, like the leaders in India were saying, "Oh, we've got over the worst of it and we've beaten it." And then they opened up and they had a number of religious festivals, and they had a number of political rallies. And those two things, the religious festivals and the political rallies, where large numbers of people were gathering, seemed to drive the current spike in terms of the numbers. So when we look at different places, I think they're at different stages. Here in Ireland, we hope, been through what we refer to as the sort of the third wave. In other countries, they're still maybe in a sort of a second wave. We have to say that in some African countries, there's very little testing going on. And yet what we have seen is in certainly one country, we believe that the president of Tanzania has died of COVID. We know that a number of ministers in places like Malawi have died of COVID. And so it's almost like this hidden death in some places. So it's middle class, it's richer people, it's poorer people who are all being affected, but maybe disproportionately, strangely enough, by maybe the ruling class in some of these countries have been disproportionately affected.
Okay. Are you in Plan a member of the People's Vaccine Campaign?
Yes, we are. We would very much advocate that you need to look at the equity around vaccines. That, again, while I know there's a big rollout going on here in Ireland and we're seeing it across Europe, But like what we say very clearly is that, we are really all in this together, and you have to get everybody vaccinated. It's not just about trying to get one country vaccinated in terms of that population. You have to work on this globally. I suppose the big danger that people are referring to is the kind of the variants, that new variants will come, and that maybe the vaccines won't be as effective against those variants. So it's important that there is much greater equity around the sharing of vaccines across countries, because we have seen it, that in different developed countries, the sheer numbers of vaccines that they have procured, in some cases, like I believe in the case of Canada, is 3-4 times its own population. So that doesn't seem right to us when we look at very, very poor countries that just haven't been able to kind of procure vaccines, and they seem to be at the bottom of the pile again.
Okay, we move on to talk about just one more issue. It's related. COVID is related to it as well, but you can talk more about it if you can. Yourselves and Plan signed a letter with 200 other organisations recently, didn't you? Could you tell me more about this?
Well, I suppose it's to try and bring attention and to try and move attention onto what we see as a massive food crisis at the moment, and in some cases it will develop into famine. And we look at, again, and I think there's the things I've referred to earlier, Darren, are really the drivers of this food crisis, which is conflict, the climate, and the COVID all combined. We were up to the end of 2019, we had been seeing over the previous kind of 15, 20 years, very, very steady progress on things like extreme poverty, where we were reducing the numbers of people and the percentage of the world population living in extreme poverty. But COVID has completely reversed that. So what we've seen in the space of a year is what we refer to as the losses, the development losses of around 20 years as a result. And we're seeing a kind of an increase in the numbers of people living in extreme poverty. And where that affects, people, like it can be around access to food, and that access or the availability. So in some countries like South Sudan or Yemen, there is just not the availability of food for people. And so it's around bringing in food, bringing in nutritious food for younger children so that they can be fed. But in other places, it may be around access to food. So you can imagine here in Ireland, if you don't have money, well, the supermarkets may have food, and if you don't have money, you can't procure. And it's again the very same for very poor people in a lot of developing countries. If you don't have a job, if you don't have money, you just cannot procure or cannot buy food. So in those cases, what we're trying to do is a lot of cash programs and being able to, in a sense, give people cash so that they can go and they can buy food themselves, which may be available. So that whole initiative, bringing a whole load of organizations together, is to try and draw attention on what's actually happening. So while, yes, we're all dealing with COVID, it seems to be the only thing that we hear about, where in actual fact there's an underlying food security, famine issue developing that is getting very, very little attention, and certainly very little attention in terms of the donors providing money to be able to prevent this.
And I believe what you were saying as well in that letter, you were drawing attention to that there's still, even today, a huge amount of money still getting spent on arms, isn't there, around the world?
Yeah, we have to draw attention in some ways, kind of, to just the inequality, if you want to use that word, that so much money can be spent on arms, so much money can be spent on other things, rather than kind of been looking at the amount of money it would actually take to solve some of the problems. So we often talk about this around the political will. Our globe has the capacity to very easily solve a lot of the problems that we face if we had the political will to be able to put our resources really where they are required, and making sure that countries which are, for whatever reason, are not as developed as ours, actually do receive assistance and are helped in these times to be able to help their population. Because if you don't, then you're just going to see this cycle of poverty continuing. And if you, like, I suppose it's making the comparison in a sense of what's spent annually in terms of arms sales and defence compared to what's spent in terms of, or what's required in terms of being able to put money into programs that will help people to develop. So it's just, in our focus in terms of focusing on poor people and in poorer parts of the world, we just find the injustice of spending money, massive amounts of money on terms of arms and being armed so many times over to the teeth, and not looking at these other issues that are there staring people in the face. And it's just using that figure to draw attention to the needs that are out there now in terms of food and that for people. No, that's fine, Darren. I much appreciate you doing this because it's very hard to get these stories out. I know we're very focused on ourselves at the moment in terms of what's happening, and we just feel we've become much more introverted, or we're looking much more at ourselves and what's happening with us. And there's an awful lot of things happening around the world in different countries that we're just not hearing anything about. And it's great that you're bringing attention on this. So thank you, Darren.